Energy and Commerce Committee will come to order. Thank you to everyone for participating in today's Member Day. We're celebrating the rich bipartisan history of the Energy and Commerce Committee. For more than 227 years, this committee has taken on some of the most difficult challenges of the day. We do the hard work, plow the hard ground necessary to legislate and deliver results. It's the oldest committee in Congress. It was here at the beginning for the very first hopes and dreams in the promise of America, where we have lifted more people out of poverty and led the world in raising the standard of living through free markets, free speech, and individual liberty. Each of our colleagues, who we'll hear from today, has the honor of representing about 750,000 people. And just like us, they were duly elected to serve and are committed to working on ideas to improve people's lives. Today is about listening and learning about what our colleagues are leading on and why these solutions are important in their districts. It's an honor to host this Member Day with Ranking Member Pallone. I'm grateful for his leadership and friendship as we work together to build a brighter future across America. So to all the members today, thank you, welcome, and I look forward to hearing about your work in legislation. At this time, I'll yield to the Ranking Member, Mr. Pallone, for his opening statement.
Thank you, Chair Rogers. You're going to have to bear with us as we tell you how wonderful the committee is for a few more minutes. So I want to welcome our colleagues to the Energy and Commerce Committee today for our Member Day hearing. The committee has accomplished an incredible amount in recent years. We played a central role in passing the 4 major bills that became law over the last 3 years. The American Rescue Plan jump-started our economy and provided the tools and resources to save lives from the COVID-19 virus. The bipartisan infrastructure law is revitalizing and modernizing our national infrastructure. The CHIPS and Science Act is reinvigorating domestic manufacturing and ending our dangerous dependence on foreign manufacturers of critical goods like semiconductors. And the Inflation Reduction Act is lowering health care, prescription drug, and energy costs for American families while also finally aggressively combating the worsening climate crisis. And this is not to suggest that Ways and Means or others committees have not been involved in these bills as well, because we know they have. But an important part of our ability to consistently deliver for the American people is regularly hearing from and working with members both on and off the committee to provide insight, bring new ideas and perspectives, and to help us advance legislation that makes a difference in the lives of our constituents. Committee Democrats continue to be laser focused on lowering costs for American families, growing our economy, protecting consumers, and leading the world in the clean energy transition. So look forward from hearing from our colleagues today and continue to work with you. And with that, Madam Chair, I yield back.
Thank you. Thank you, everyone. We're going to get started, get to as many members as possible before they call votes. We're going to start with the lady from Washington State, colleague from Washington State, Representative Del Benny. 5 minutes.
Thank you, Chair McMorris-Rogers from the great state of Washington, and Ranking Member Pallone for inviting members to testify before the committee today. Today, I'd like to speak on the urgent need to enact a national data privacy law. Data privacy is a 21st century issue of civil rights, civil liberties, human rights, and the U.S. has no policy to protect our most sensitive personal information. The advancement of artificial intelligence has captured the attention of policymakers and the American public alike. And while we certainly should be having discussions around what guardrails need to be in place for sensitive applications and ensuring AI is not developed with biases, we must also make sure data privacy is a central part of that conversation. Privacy policy goes beyond just AI and applies to many ways American people interact with technology on a daily basis. AI needs an immense quantity of data, and developers currently do not need to disclose where they get their input data from because the U.S. has no national privacy standard. As a result, we don't even have a clear understanding of how our data is being used to build these systems. From AI to social media to fitness apps to smart devices, people should be in control of their data. Right now, the companies that collect our information control how it's used. When we don't have a clear domestic policy, we aren't able to shape standards abroad, and we let others drive global policy. We're behind on technology policy already, but we're falling further behind as other countries take the lead. So I applaud the committee for the great work you did in advancing a bipartisan data privacy bill last Congress, but we haven't crossed the finish line yet. A strong national standard on data privacy has to put people back in control of their information instead of companies. I believe it must also be uniform throughout the country rather than a state-by-state approach that we have now. It must be enforceable so that the government can hold bad actors accountable. And privacy protection should not be a one-and-done thing. We must continually ensure companies are being responsible with the data that they have. I appreciated working with the committee last Congress to strengthen the biannual impact assessments and ensuring the FTC could assess these assessments. I know this committee shares my sense of urgency on this topic, and I look forward to continuing to work with you to build upon the success of last Congress and finally pass a comprehensive data privacy bill. Thank you again for the opportunity to testify, and I yield back the balance of my time.
Thank the gentlelady for being here. Appreciate your leadership on this issue. I think we would agree that we'd find a lot of agreement on this. We are hoping to move forward on a bill later this Congress. Yes.
Well, I would,
Yeah.
totally agree with the chair. This really is our priority. Above all legislation, this is our priority. And we're just constantly trying to get members and other committees, to be supportive of this on a bipartisan basis and also work with the Senate as well. So you're speaking to the choir, which you know.
Thank you for highlighting the issue and for your leadership. Next, we'll move to the gentleman from Indiana, Representative Baird. 5 minutes.
Good afternoon. And thank you, Chairwoman McMorris Rogers and Ranking Member Pallone, for allowing me to address an issue plaguing my congressional district in Indiana and many cities across the country: catalytic converter thefts. Now, from the outside looking in, I'm sure catalytic converter theft may seem like a small problem, but many police officers across the country and the victims of these crimes will tell you otherwise. And for those of you who are unfamiliar with catalytic converters, this required part is used to reduce the potency of toxic emissions from an internal combustion engine and is made up of platinum group metals called PGMs, which can be sold to scrap dealers for hundreds of dollars on the black market. The value of these metals, combined with the thief's ability to remove them from a car in a matter of minutes, makes them a prime target for criminals looking to earn cash with little risk. And they tell me that with a Sawzall, it really just takes seconds to take these out of a vehicle. The replacement of these parts can sometimes cost a vehicle owner thousands of dollars, and in some cases, when the part is removed hastily, it can even destroy or total a vehicle. So thanks to the loopholes in current federal law, police departments lack the necessary support to hold thieves accountable and to locate stolen parts, which is why I introduced the Preventing Auto Recycling Thefts, the PART Act, H.R. 621. My bill takes a multi-pronged approach to tackling this problem by including traceable identifying features on catalytic converters, addressing how parts are purchased, and strengthening enforceability of catalytic converter thefts. By creating a system where law enforcement can link stolen catalytic converters from their vehicles of origin, closing the decanning loophole on catalytic converters, and codify catalytic converter thefts as criminal offenses with criminal penalties, it is my great hope that we can curb these costly thefts. Catalytic converter theft is nothing new. Thieves have known they could make money from the valuable components of these parts for years. Unfortunately, though, in recent years, since the onset of COVID-19 pandemic, an increase in the price of the precious rhodium, palladium metals in catalytic converters, combined with an abundance of new free time, have sent these crimes into overdrive. In the past 4 years, the theft of catalytic converters went from hovering around 1,500 incidents per year and exploded to more than 150,000 incidents per year. Worse yet is that many of these reported incidents represent the theft of dozens of parts at one time, like the theft of 40 catalytic converters from a hospital parking lot in northern Indiana, or the theft of more than 90 catalytic converters from an RV factory in Elkhart County. This bipartisan, bicameral legislation brings a common sense solution to problems that affect every single one of our districts, and one that has huge financial strains on families and small businesses. This is a bill that largely supported by major cities Chiefs Association, the National Automobile Dealers Association, the National Insurance Crime Bureau, the Institute for Scrap Metal Recycling, the International Association of Auto Theft, and investigators, and several others. So I want to thank Representative McCollum, who is co-leading on this legislation, and my colleagues on both sides of the aisle who have joined me in this effort to empower law enforcement and deter future theft by joining the PART Act. I believe that this widely bipartisan issue can be an easy win for Congress and offer a straightforward yet impactful solution for law enforcement struggling to address these rampant crimes across the country. I hope the committee will consider this impactful piece of legislation, and I yield back my time and thank you.
Thank you again for presenting your legislation. It's a huge issue in Eastern Washington, and I know it is all across the country, and we'll take it into serious consideration. Thank you. Next, Representative Davis from great state of North Carolina. 5 minutes.
Thank you, Chair McMorris Rogers and Ranking Member Pallone, and all of the members of this marvelous, remarkable, and most distinguished, did I say marvelous and marvelous? Well, thank you for allowing me to speak on issues within the committee's jurisdiction that matter to residents of North Carolina's 1st Congressional District. Since taking office in January, healthcare has been my #1 legislative priority, having led, co-led, or co-sponsored more than 50 bills in this space. As we sit here today, the people of Eastern North Carolina are hurting, and at the root of this pain is a lack of access to health care. To tackle these health disparities, I joined 2 colleagues in restarting the state Medicaid Expansion Caucus to demonstrate the overwhelming public support for basic access to health care. After more than a decade of waiting, or in some cases, dying, 95,000 more Eastern North Carolinians are eligible for life-saving health care. As a co-chair of the State Medicaid Expansion Caucus, I will continue leading in the charge in Congress to expand Medicaid across the country. Beyond Medicaid expansion, I've championed the cause of rural hospitals. In the past decade, 4 rural hospitals in Eastern North Carolina alone stopped operations, creating significant barriers to life-saving medical care. Martin General is the most recent example of suspending operations in the East. While we have limited tools at our disposal, especially in communities where the payer mix skews towards Medicare and Medicaid, the Rural Emergency Hospital Designation Authority is a critical part of the solution. Let us remember the rural hospitals not only provide health care, they also serve as an economic engine for our communities. As Eastern North Carolinians grapple with limited access to care, the opioid epidemic continues to plague the region. To combat this crisis, I introduced bipartisan legislation with Congressman John Rutherford to stem the flow of counterfeit substances, including fentanyl, that have flooded the drug market. H.R. 4988, the Modern Authentication of Pharmaceuticals Act will come down hard on counterfeit controlled substances by requiring on-dose identifiers to guarantee the legitimacy of pharmaceuticals. I urge the committee to take this legislation and put a dent in the fentanyl crisis. Just as we emphasize the importance of physical health, mental health is a critical part of children's overall health and well-being. As a father of 3, it pains me to say that our children are in crisis. Given the record number of teenagers attempting and committing suicide, to tackle this head-on, I will soon introduce a bipartisan bill in the coming weeks to combat algorithms on social media platforms that amplify the most graphic, problematic content. As the committee takes up the American Data Privacy Protection Act, I urge you to consider incorporating this bill as a common-sense solution for our kids. On the subject of improving the well-being of Eastern North Carolinians, broadband access is top of mind. Many rural and agriculture communities across North Carolina's 1st Congressional District lack broadband access. It has been excruciating to close gaps in access because the Federal Communications Commission's broadband map lack precision and accuracy. I urge this committee to ensure the FCC is making real and tangible progress in providing the public with more accurate and realistic maps. We need these maps to ensure federal dollars reach underserved communities. Another way to serve rural communities is through stable and reliable energy grid systems. People in Eastern North Carolina expect their lights, stoves, and cooling systems to work. These needs are not a given because Eastern North Carolina's grid system is much older, potentially resulting in higher utility costs for families, a greater chance of system failure due to extreme weather events, as well as increased risk of cyber threats. I ask this committee to prioritize rural energy grid systems. To ensure transparency and good use of taxpayer dollars, I co-led another bipartisan bill with Congresswoman Lisa McClain to ban government funding for animal testing. Appropriations bill for fiscal year 2024 include language closely mirroring this bill, and I genuinely appreciate the opportunity to testify before the committee today on the critical issues impacting my constituents, and I yield back.
Thank you very much. Appreciate your testimony today in front of our committee. You've outlined many shared priorities, and we'll certainly look at your legislation very seriously.
Thank you, Madam Chair. I just wanted to say, Representative Davis, that you really got to the heart of a lot of what Americans face today, because a lot of this deals with affordability, right? But a lot of it is access as well. And we have a digital divide, we have a health disparities. We've been trying, as you know, to deal with some of this. The ACA, of course, provided for Medicaid expansion, but I assume that the state legislature hasn't done that in your state, which is unfortunate because that leaves a gap, right? But we're going to continue to see what we can do to close that gap and to maybe try different things to get the states to move towards Medicaid expansion by providing more funding or a higher match, but that doesn't seem to work, so we have to look at it in other ways. And as far as broadband access, we have various affordability measures, but they need to be expanded. So these are very important things, and we're certainly going to pay attention to them. Thank you.
Thank you very much. Next, gentleman from New York, Representative Santos, recognized for 5 minutes.
Thank you, Madam Chair, Mr. Ranking Member, members of the committee. I have 3 bills that are under the sole jurisdiction of the committee, so I wanted to come by and read my thoughts on them. So I presented H.R. 2636, would amend the Public Health Service Act to include neuropathy in its list of conditions covered by the World Trade Center Health Program. This constituent-driven legislation simply adds neuropathy to the illnesses covered from the events of 9/11. To have this added in regular order through the CDC is extremely bureaucratic and has failed multiple times. And we don't have time to wait on them. Patients who claim a neuropathy-related illness would still go through the same process of having a doctor verify the condition and that the illness is in fact related to their proximity to Ground Zero in New York City. Very simple act. There's no gimmicks, just asking for a straightforward approval of this condition in the bill. HR 2631 would prohibit the federal government from imposing any mandate requiring an individual to receive a vaccine that has not been authorized for marketing for at least 10 years. So this bill affirms my commitment to protect medical freedom in NY3 and across our great nation. If enacted, this legislation ensures government transparency and provides for accountability if other public health emergencies occurs. So just really allowing the people to have a choice. HR 2635, the Big Tech Accountability Act of 2023, would amend Section 230 of the Communications Act of 1934 to limit liability protection provided by such section for providers of social media services. For over a decade, conservatives and Republicans have been unduly targeted by big tech and deplatformed and censored, myself included and many colleagues of mine in this body. With no real legal protections or actions from Congress until now, this bill allows for accountability if a citizen of the United States is deplatformed or censored while upholding the rights of private companies. I highly suggest consideration of these bills to engage in discourse and, if obviously, productive conversation and debate so we can work together and move for a path forward to represent people. But I appreciate the time, Madam Chair. Thank you for all the work you do, and I know you guys do fantastic work in the committee. Thank you for having me today. I yield
Thank
back.
you. Thank you for taking the time to highlight these bills. Appreciate your work on all these fronts. So we will take them into consideration and certainly circle back with you.
I just wanted to ask briefly, on the first bill, I've been very much involved with the World Trade Center program because in my district we had a lot of people impacted. And I know the process whereby, I guess it's CMS or no, there's a process whereby different diseases or disorders can be added to the list. Now, what has happened with that? In other words, have they said there's just not enough evidence, or what's the reason why they haven't?
So in 2017, the first attempt to add neuropathy was dismissed as insufficient evidence, and a second attempt was attempted in 2019. Now, there's somewhat about 70 firefighters who have ever since registered to have evolved with cases of neuropathy, and the commission continues to decline sufficient evidence. I don't think it's a coincidence, Mr. Ranking Member, that it's very hard to say there isn't a coincidence and a link tie. These 70 firefighters served on Ground Zero, either on or after the events of 9/11. So having constituents in my district with the case, I've seen it firsthand. My guest of the State of the Union this year, Michael Weinstock, is a firefighter who his life has been completely debilitated due to neuropathy, and he's unable to practice law. And it's disheartening to see that they get absolute no support from the commission. So I think it would be really an act of Congress would make this right for a lot of people. And I believe that going through the commission is proven to be less than fruitful for them. So this body should be able to deliver it for them.
All right, thank you.
Thank you, sir.
I appreciate that input. Thank you,
Okay,
Madam Chair.
thank you very much. Next, we'll move to the Chairman of the Homeland Security Committee, Representative from Tennessee, Mark Green. 5 minutes. Welcome.
Thank you, Chairwoman McMorris Rogers. It's great to see you. And Ranking Member Pallone, thank you for this opportunity to testify to the committee about my bills addressing the alarming conditions of our rural healthcare systems. I know that you've heard the same sobering stories from constituents, physicians, hospital administrators, and parents. Our rural hospitals are entering a financial and workforce crisis. As an emergency care physician and former CEO of an emergency department management and staffing company, I've seen firsthand how desperate the situation has become. It's only gotten worse in recent years. Rural hospital closures and limited access to emergency medicine significantly impact my home state of Tennessee. According to the U.S. News & World Report, Tennessee has seen more hospital closures than any other state besides Texas. In fact, the Tennessee Hospital Association estimates that 45% of Tennessee's hospitals are at risk for imminent closure. This is an impending disaster, not just for the loss of care, but also for the loss of jobs. According to the American Hospital Association, over 130 rural hospitals across the country closed their doors from 2010 to 2021. And according to a GAO report from December 2020, the median distance of travel rural patients must drive to receive care increased by 20 miles, adding an ever-expanding barrier to essential inpatient and emergency care. In order to combat this worrying trend, I introduced 3 pieces of legislation as part of my broader rural health care initiative, 2 of which fall within the committee's jurisdiction. My first piece of legislation targets a specific issue in the hospital system, ER departments. H.R. 1129, the Rural ER Access Act, would repeal a subsection under Title 42 U.S. Code of Federal Regulations that prohibits freestanding emergency departments from operating more than 35 miles from a hospital. This 35-mile perimeter rule was instituted in the 1990s to monitor the safety of ER patients. HHS was concerned that if ERs operated too far from a self-sustaining hospital, that those emergency patients would have no other medical options should the self-standing ER department fail in its mission to treat and triage. However, speaking as an ER physician who practiced medicine in rural areas across our country, I know how advanced our medical technology is today, and I know how desperate some situations are. This antiquated rule that was a number just pulled out of the sky is hindering patient access rather than saving patient lives. Keep in mind, this arbitrary mileage was just imposed by a bureaucrat at HHS with little knowledge of its real impact. Congress must weigh in to correct this outdated rule. Furthermore, by eliminating this mileage requirement, freestanding ERs can provide the frontline emergency care to rural communities most desperately in need. These facilities provide a critical safety net during an emergency, particularly in rural communities where the nearest hospital may be many miles away. Moreover, keeping a freestanding ER open and operational will keep jobs in a community and help support the local economics of hard-to-reach areas. We also have to address the workforce burnout amongst our medical providers by enacting H.R. 5213, the Reducing Medical Unnecessary Delays in Care Act. This legislation is endorsed by the Medical Group Management Association and the American Academy of Family Physicians, and it seeks to unburden our doctors from bureaucratic red tape that is prior authorization. According to the Medical Group Management Association, and I quote, 72% of medical groups report that the clinicians assigned to complete their peer-to-peer reviews by the plans are not from a relevant specialty to treat the disease in question, resulting in dangerous delays and, unfortunately, flat-out denials, end quote. My bill would reform the practice of prior authorizations in Medicare and Medicaid and Medicare Advantage. Only board-certified physicians in the relevant specialty should make these critical decisions about care. I'm going to jump off script just a second. If you make the decision as a payer to take, let's say there's 5 ways to treat something, and you make the arbitrary decision to remove 3 of those, that's a medical decision. Somebody is making a medical decision, and it should be the medical provider trained in that particular practice who makes that medical decision, not a person behind a screen in a computer. Medical decisions must be decided by the medical professional, meaning no accountant or government bureaucrat should ever have the power to remove an option of care because removing options is a medical decision. Furthermore, with the advancement in AI in the medical field, there are growing concerns that computers will be the ones making these medical authorization decisions, tying the hands of trained physicians. This would be catastrophic to physician autonomy and, I believe, to patient care. These bills aim to restore our rural health systems and save our patients from needless and dangerous delays in care. With this committee's help, I look forward to improving our medical system. Madam Chair and Ranking Member, thank you very much, and whatever I can do to move these along, I'm with you.
Thank you. Thank you for your leadership on both of these bills. I share the concerns around prior authorization and the importance of making sure that it's doctors making these decisions, doctors and patients, and I appreciate you highlighting the bill relating to the 35-mile prohibition also. We'll take a look at both of those and appreciate your work and leadership. Thank you very much. Okay, thank you. Next up, gentleman from Wisconsin, Mr. Grothman.
Thank you. They have you called, they wrote you down, Madam Chairwoman. Madam Chairwoman, members of the Energy and Commerce Committee, I sit before you today with a vital piece of legislation which is inexpensive and will save lives. And I'm happy to have the sainted Congresswoman Dingell on as co-lead. This legislation was inspired by the life of Dylan Miller, a young man whose legacy continues to resonate in the hearts of those who know him. Dylan Miller died of a bee sting. Can you imagine anything worse than being a parent and having somebody 18, 19 years old, you think he's a healthy, wonderful kid, popular kid, die of a bee sting? He's from Mishkot, Wisconsin. He was a bright student full of life, dreams, and aspirations. But because of a bee sting, that life was cut short. His parents, in the face of unimaginable grief, chose not to let their son's death be in vain. Instead, they embarked on a journey to ensure that no other family would suffer the same tragedy. In their quest for change, Dylan's parents championed the cause of anaphylaxis awareness and prevention, right? People can die within 15 minutes of getting a bite from a bee sting. And that's before, frequently emergency staff can get there or anything. So we'd be so much better in our society if we had people trained on giving the shot that would be able to keep these people alive. Before we delve into the specifics of the federal version of Dylan's Law, and some states have a state version, it's essential to grasp the gravity of the issue. Anaphylaxis is a severe, life-threatening allergic reaction that can occur within minutes of exposure to allergens, that not only bee stings, but foods, nuts, or medications. Each year in America, between 500 and 1,000 people die of anaphylaxis. This condition also leads to hundreds of thousands of hospitalizations and emergency room visits annually. The numbers alone underscore the urgency of taking meaningful action. Dylan's Law, at its core, is a common-sense response to this life-threatening problem. It empowers ordinary citizens to become heroes when the seconds count. Under this law, states are incentivized to allow individuals to be trained and certified to carry and administer epinephrine, a life-saving medication. This rapid intervention can mean the difference between life and death. What makes Dylan's Law even more impactful is the potential to serve as a model for new states. By offering grant preferences to states that adopt similar legislation, we can create a nationwide network of trained individuals who will spring into action before you can transport that individual to an emergency room. Preventive health services are the heart of Dylan's Law. By incentivizing states through grant prioritization, we encourage them to establish training programs that certify individuals to administer epinephrine. These programs are not just cost-effective, but they are also quick and efficient. With proper training, ordinary citizens can become the first line of defense. Dylan's Law also takes a step further by requiring states to implement civil liability protections for those trained in administering epinephrine. This provision ensures that individuals who step up in an emergency are not burdened with unwarranted legal consequences. Dylan's Law has garnered support from a variety of organizations dedicated to healthcare: the Asthma and Allergy Foundation of America, the Food Allergy Research and Education Administration, American Osteopathic Association, and the Elijah Alibi Foundation are among the champions of this legislation. In closing, Dylan's Law is more than just a legal framework. It's a symbol of hope, compassion, and preparedness. As we move forward, let us remember that those can be ordinary people like you and me who can jump in if something horrific would happen. And what I'll do, kind of depart from the comments here, is if you can imagine what it must be like to have a 13 or 14-year-old child who dies of a bee sting or dies of a food that he didn't know was there, it's just horrific. And there is no reason why in this country we cannot have thousands of people take these classes, be it service clubs, be it first responders, be it medical staff, and if they have this epinephrine with them, they can spring into action and save young lives. And I'll tell you, to this day, it breaks my heart when I see Dylan's mom and knowing what she had to go through when she had, a healthy, young, athletic guy and son, and to die of a bee sting. And we can do whatever we can to prevent this sort of death that can happen to anybody with none of their cause, nothing they could do to avoid it. Wouldn't it be great if we could have thousands of more people out there in America ready to spring into action?
Thank you. Thank you for your testimony and for making sure that we remember the legacy of Dylan Miller.
Thank you for having me.
Very good. Next, lady from Indiana, Representative Sparts. Recognized for 5 minutes. Welcome to Energy and Commerce Committee.
Thank you so much, and thank you for having me. And thank you for your willingness to deal with some tough issues that are not maybe very, sexy to go on TV and tell how you fight in the trenches, but it is in the trenches and issues that affect every American, and not very positive right now. It's issue of health care. No matter where we stand on this issue, no matter what solutions we're going to propose, but if we don't do something about it, we're going to bankrupt our country, we're going to bankrupt American families, and a lot of lives that we can save are not going to be saved. So I think it's a very serious issue, and I know that it's not an easy one, because there are a lot of groups that like status quo, and there is not one evil, but ultimately our job is to challenge the status quo and find solutions. So I appreciate that Speaker McCarthy was willing to have a task force, Healthy Future Task Force. I was part of it on the Affordability Subcommittee. And I generally look, as a free enterprise Republicans, I look what is the issues that how we restrict competition for value, not for money and fee-for-service, but actually for value and better outcomes in healthcare, and how we create perverse incentive that destroy our healthcare truly. And the effects of it they're so magnificent that if we don't deal with that, we're going to destroy our country. And I'm not saying this is without, just for the grandstanding. I truly, look at that. 1 of 7 Americans is in that collection. How is it going to affect the future of a lot of people for medical debt? A lot of Americans don't have a proper access to health care. A lot of Americans cannot afford basic services. And it's not because we don't have ability to be innovative and have a competition and have this enormous innovation that can happen. It's because we do a lot of protectionism. And I'm talking as an institution, and I'm not just saying that this Congress, causes all problems. It's been created by a lot of other Congresses, but we are the part of the problem, or we decide to be part of the solution and make some incremental change. So I wrote standalone 7 bills just dealing with this issue, and 5 of these bills are in your committee, so I'll just briefly talk about them. I'm sure you're familiar with them. You've been working on this issue, and I really appreciate it because I know challenging Washington, D.C. machine, and it's not easy thing to do on a bipartisan basis. It's very hard to do it. Specifically, challenging the Senate. I think, people, they totally forget where they come from because they don't have to run every 2 years. So unfortunately, if the House is not going to stand up, we're going to fail. The House will have to win this battle. So one of them, some people call it site neutrality. Some people call it dishonest billing, but ultimately it's, overbilling. I would say dishonest is like fraudulent overbilling of Medicare. This is over $200 billion of fraud in our system in Medicare that going bankrupt within 5 years. And this is what it means, that it's going to hurt people that need these services the most. So if we want to save Medicare for seniors, and things that we promised for them, we need to have the backbone to challenge. Some of these places building big Taj Mahals, executives making billions, have billions on Wall Street. So we have to decide, are we for the Main Street or for the Wall Street, and not be hypocrites. This is an issue that as bipartisan can be. Families USA supported, Big Labor, Heritage Foundation, Americans for Prosperity, as Americans Enterprise Institute, and Brookings. This is the issue that Trump and Obama could agree on, okay? And this is an issue that should not be, partisan. Well, we have a problem with the Senate. You know what? We have to challenge the Senate. We have to stand up for the people. We are ultimately people's house, and we have to be able to win for the people. There is another issue dealing with, antitrust enforcement. We don't even have jurisdiction for over so-called nonprofit, tax-exempt hospitals. We need to be able to see when they abuse the system, how to deal with that issue. We need to see how the states, there are some states can be hypocrites too. What is the competition there? Because they like to blame federal government, but sometimes they're guilty too. And I tell you, as this former state senator, it's very difficult to deal. How can physicians not be allowed to own hospitals? I mean, this is a legal business, and these people in practice, they will provide the most value. Why we do this restriction? Doesn't make sense. They will be the ones who want to provide the best value, know what's happening. And then we have a lot of clauses. We did some with gag clauses, but there are a lot more anti-competitive clauses, and including inpatient-only lists, which unfortunately become politicized, but ultimately it's between patients and doctors, and people will provide the values because this is what the people know what the best for the people. So I would appreciate your consideration. I would appreciate that you're moving, at least incrementally, on these issues. And in any way I can support, I know it takes toughness, but it will take tough people like in this committee, and I appreciate it very much.
Thank you very much. Appreciate your testimony. This Congress, we've been focusing on what's driving the cost of healthcare and looking at the consolidation within the healthcare system and the impact that that's having. We do have at least one provision in the price transparency bill that we are hoping that will be on the floor today that includes site neutrality payments. And we're going to continue to look at all the issues that you outlined. Appreciate your leadership and your passion for all of these issues. Okay, they've called votes, and I think we should recess, and we'll come back after votes and hear from more members. Thank you, everyone. Energy and Commerce Committee will come to order. We continue our member day. Pleased that everyone is here. We're going to hear now 5 minutes from gentleman from Guam, Rep. Moylan.
Madam Chair, thank you, and for the opportunity to appear before the Energy Committee and Commerce here. So appreciate it, and bringing up the issues that affect my district in Guam. Specifically, medical care is a big challenge for Guam, and many specialists and facilities do not exist on Guam, and this is compelling my constituents to often seek medical care in the Philippines. So to enable more unencumbered access to medical care in the Philippines, I've drafted legislation to enable the portability of Medicare benefits to the Philippines. So this legislation will allow Americans living in Guam and the Philippines with more options to improve access to high-quality health care. VA benefits, TRICARE, and Social Security benefits are all available to Americans living in the Philippines now. So I believe adding Medicare to the list would save taxpayers money due to the lower cost of healthcare in the Philippines. I've also experienced treatment myself there. It's very effective, very good. It only takes a 4-hour flight to go to the Philippines. If you were to go from Guam to Hawaii, that's 8 hours. If from Hawaii to LA, that's another 5.5 hours. So really the closeness, proximity, it will be very helpful if we can get that Medicare benefit portability to the Philippines. So that's one. The other issue we're facing in my district is the resilience of our power grid. Okay, although reliable access to power for my constituents is top of my mind, this issue is also a matter of national security because the military is Guam Power Authority's largest customer. So with the increasing irregularities and the intensity of typhoons, we just finished one, Super Typhoon Mawar, undergrounding the power lines and building and hardening the grid for Guam makes America stronger. And as I work with strengthening our power grid on Guam, I look forward to working with the committee, seeking waivers for the NDAA language and moving other legislations relating to Guam power grid. So I thank you, Madam Chair, for the opportunity discussing portability of Medicare for Guam residents to the Philippines and also hardening our power grid for the residents of Guam, especially for our national defense. Thank you, Madam Chair.
Thank you. Thank you for raising those issues. Appreciate it. I don't have any questions.
No questions, just thank you. We appreciate the heroic history of Guam and America, and we have a duty to you.
Thank you. Thanks for taking the time. Next, Representative Carey from Ohio, 5 minutes.
Thank you, Chairwoman McMorris Rogers and Ranking Member Pallone, for giving me the opportunity to testify today. I represent Columbus, Ohio, home of The Ohio State University. So it won't surprise you that I'm here to talk about college sports. Specifically, I'd like to discuss name, image, and likeness, or NIL. As you know, college athletes are now able to profit off of their name, image, and likeness. Numerous states have implemented NIL laws with conflicting rules, therefore making the landscape for NIL hard to navigate for universities and for our student athletes. Numerous states have implemented these NIL laws, and we in Congress need to create one federal standard for the NIL that protects student athletes and the future of college sports. Congressman Landsman was here with me today, and I introduced the Student Athlete Level Playing Field Act earlier this year, and it is the first NIL bill that was introduced into Congress, and it is still the only bipartisan NIL bill in the House. Numerous other members of the House have since proposed legislation to create one federal standard for the NIL, including Commerce Subcommittee Chairman Bill Arakis, who I'm sure you are all pretty familiar with. His legislation, the Fairness, Accountability, and Integrity and Representation of College Sports Act, or the FAIR Act, makes it a little simpler, shares many similarities with the Student Athlete Level Playing Field Act, including the FTC endorsement, enforcement against bad actors, requiring student athletes to be enrolled in an institution before signing an NIL deal, requiring the registering of agents, and establishing a clearinghouse for NIL deals that will increase transparency into the system. I appreciate the committee's and Chairman Bilirakis' efforts to include us in this process as we are encouraged to see the provisions of our bill incorporated into the newest discussion of the FAIR Act. I strongly believe we need to pass NIL legislation this Congress while we have momentum in the House. I'd like to thank Representative Bilirakis, Cleaver, and of course Greg Landsman, and all my other colleagues who have made it a priority to advocate for NIL legislation. I look forward to continuing to work with you on all of these issues. I thank you for your time, the committee's time, and I yield back.
Appreciate the gentleman raising the issue. Many on this committee share your concern and belief that we need to take action this Congress. We look forward to working with you and appreciate your work on the legislation. We'll keep on it.
I thank the gentleman for a great presentation. We in Florida love college sports, obviously, and I believe a national standard would benefit all states, knowing that there's right now NIL is driving a lot more of this than athleticism, and we need to get back to the original intent.
Thank you. Thanks for taking the time.
All right, thank you.
Okay, next, representing the PAC 2. Congressman from Washington State, Representative Newhouse, recognized for 5 minutes. Welcome.
Thank you, Chairwoman McMorris Rogers, Mr. Soto, members of the Energy and Commerce Committee, for allowing me to speak on an important issue that impacts communities all across our nation. Just last year, as you probably know, over 100,000 people in the United States died from a drug overdose, largely driven by the rampant spread of illicit fentanyl. That number exceeds, and I'm from this generation, the total casualties of the entire Vietnam War. While this spread continues to grow in urban neighborhoods, it's also spreading rapidly in rural communities like mine in central Washington. We cannot stand idly by while this is happening. Earlier this year, Mr. James Wanacott of Yakima reached out to my office and told me the tragic story of two of his sons, William and James. Andy's son, William, passed away from a fentanyl overdose in April of 2021. Then the following year, he lost his son, James, to the same tragic fate. After speaking to Andy, I knew something more must be done to address this crisis. I introduced H.R. 1597, the William and James Wanacott Act, which enhances penalties for those who sell, give, or distribute any substance that contains 2 milligrams or more of illicit fentanyl to another person without their knowledge. This legislation is critical, and I strongly encourage my colleagues on this committee to consider it as a means to hold bad actors accountable. Well, I believe that that's a positive step in the right direction towards holding drug dealers accountable. I realize more must be done. The solution requires an all-hands-on-deck approach with a broad range of solutions and perspectives, which is why I created the Central Washington Fentanyl Task Force. And from what I've seen, correct me if I'm wrong, it's the first of its kind in the nation. This task force includes members of law enforcement, addiction treatment groups, medical professionals, drug court officials, school resource officers, tribal leaders, elected officials, community leaders, truly the best minds and resources to tackle this growing threat. We found that the mortality rate of illicit fentanyl and synthetics among adolescents has increased dramatically in just the past few years. It's clear our police officers, our school resource officers need more resources. This week, I'm introducing the Stop Overdose in Schools Act, which would address the skyrocketing adolescent overdose rate. Specifically, this legislation sets aside funds for naloxone training and purchasing. It increases naloxone access for school resource officers, security personnel, and school nurses. To ensure these resources are targeted to the appropriate communities, the bill requires that 50% of the grants be awarded to school districts in rural areas, as well as the other 50% to be dedicated to school districts located in areas with high rates of drug-related overdoses by youth. This legislation will be critical in helping our frontline workers to prevent drug-related overdoses of American youth. I urge my leadership on this committee to swiftly schedule this bill for a hearing and give it strong bipartisan support. You know, while there's no silver bullet to solving this crisis, I'm confident, if enacted, common sense legislation can play a vital role in creating a safer future for our families and for our communities. And so thank you, Chairwoman Morris Rogers, for giving me time to discuss something that's so important to our region and our entire country. And also thank you for your leadership. I yield back.
Thank you. Thank you for your work on this legislation and your leadership in Central Washington. It's a very important issue to the committee. We have families that are being torn apart, as well as communities with all of the overdoses. So we'll take a look at those bills. Thank you.
We know drug overdoses top cause of death for folks between 20 and 40 years of age in America right now, and we have to help treat those who are addicted, prevent those from young people from getting addiction, go after drug dealers, and also make sure we are improving the amount of funding for our ports of entry and at our border for high-tech solutions to help stop this from coming into the country too. Thanks for your great legislation.
Thanks for being here. Next, we'll hear from the lady from Michigan, Ms. McLean, for 5 minutes.
Thank you, Chairwoman Rogers, and thank you, Mr. Soto, for allowing me the opportunity to discuss my bill, H.R. 5020, the Accountability in Foreign Animal Research Act. The AFAR Act is a bipartisan, bicameral, and I thank my colleagues, Rep. Don Davis and Senator Joni Ernst, for being great partners on this. The bill is really simple. It prevents our tax dollars from funding animal research experimentation in adversarial countries, China, Russia, Iran, and North Korea, or any labs that are controlled by these countries. China has 26 labs, most with ties to CCP, that the NIH has approved to receive taxpayer funding for research in which we have no control. Prior to Russia's invasion of Ukraine, there were 4 labs approved for funding inside Russia. Let's first talk about China and the damages they pose. I strongly believe, and others such as the FBI and Department of Energy and scientific experts increasingly agree, that COVID-19 virus originated in the Wuhan Institute of Virology and was likely caused by NIH-funded gain-of-function research. This lab was completely unaccountable for the dangerous research they conducted, which was prohibited under U.S. policy at the time. Now, regardless of whether or not you believe that this virus originated from this lab or by any other means, one thing is obvious. The Chinese have proven they should never receive 1 cent more of funding for animal research from our U.S. and our U.S. tax-paying citizens. In fact, HHS just announced it was spending federal funding to and proposed the Department of the Wuhan lab. However, records show that as recent as last year, the NIH lobbied against efforts to cut off funding for the Wuhan lab. And millions of U.S. tax dollars are still being sent to other Chinese labs. Look at what Russia did with their funding. One experiment, 18 healthy cats had portions of their brains removed with electrodes implanted in their spines. The cats were then subsequently forced to walk on treadmills for spinal cord experiments. When this was revealed in the aftermath of Russia's invasion by the White Coat Waste Project, a nonpartisan watchdog organization who had worked with the Republicans and Democrats on this committee, I immediately sent a letter to President Biden demanding he take swift and decisive action to block any further U.S. tax dollars from going to Russian labs. Funding to these 4 labs has since been banned. I understand that some may have concerns that banning animal experiments may put research on life-changing and life-saving medication at risk. However, this bill does not place a total ban on all animal research. There are roughly 190 other countries, including our own, that would still be eligible. Can't we all agree that these 4 countries, in particular, should not receive taxpayer funding? These 4 countries have been singled out in numerous statutes as countries of concern. Language similar to this was included in the FY23 appropriation bills. This year, language similar to AFAR was included in numerous appropriation bills passed out of committee. This shows there is bipartisan, bicameral support to take away funding to only these 4 countries. I thank the committee again for your time and allowing me to speak about the AFAR Act, and I hope that you consider this important measure. And with that, I'm happy to answer any questions, but thank you again.
Thank you for your testimony. Appreciate it.
Thank you.
Very good. Next, gentleman from New York, Mr. Williams, okay, Mr. Williams, yes. Recognized for 5 minutes. Welcome.
Thank you, Madam Chairwoman and Mr. Soto. It's an honor to be here. We must rebalance our nation's investment in our energy infrastructure. As you are aware, energy in all of its many forms and uses is fundamental to our economy and to our way of life. Recently, the world witnessed the terrible cost and consequences of Europe's over-reliance on and over-investment in renewable sources of energy. As their access to natural gas from Russia was cut, energy costs rose rapidly and threatened households' ability to heat their homes. Factories shut down. Coal-fired power plants were resurrected to provide the basic power to keep Europe's economy intact. My favorite fact was that when the European Union discovered 2 new green energy sources in response to this crisis, natural gas and nuclear power. Even with this dramatic real-life example in Europe, again pointing out that the European Union has revived investment in nuclear power and natural gas to keep energy affordable, reliable, responsible, and resilient, the United States appears to have learned nothing. Instead, it is now estimated that America has embarked on a $6.6 trillion investment in renewable energy, driven by the incentives baked into the deceptively named Inflation Reduction Act. This irresponsible distortion of energy investments in this country is leading the country toward energy poverty, not energy strength. Instead, I would urge this committee to urgently steer our nation toward a safe harbor of energy investment, one that balances affordability so working Americans are not unfairly punished by this unbalanced approach. Reliability. Everyone knows we can't depend on renewables for baseload power. Renewables require backup sources to provide power when the wind doesn't blow and the sun doesn't shine. And battery technology is not nearly mature enough to affordably provide this backup. Resilience. Our power grid has to absorb changes in demand and interruption, whether it's storms of nature or acts of terrorism. And it must be responsible. America has reduced emissions from power generation steadily over the last 10 or more years, and I support continuing that trend well out into the future. In my role as the chairman of the Energy Subcommittee for the House Space, Science, and Technology Committee, I've had the privilege of touring many of our nation's energy research labs. The future of energy innovation has never been brighter, but we must make balanced investments in our energy future. Specifically, we must play to our strengths: natural gas, continued innovation, and accelerating advanced nuclear. I will say again, the vast amount of federal incentives are exclusively going to renewable projects. We know that renewables aren't efficacious everywhere. I live near Syracuse, the second cloudiest city in America. We have let politics and not engineering and economic realities drive our strategy. It's not too late to turn this ship around. In closing, I would point out that the mantra of the Green Lobby has been all of the above, all of the above. But like all the strategies of the progressive left, their message was a ruse. They have succeeded in directing trillions of dollars of investment to their corporate and political sponsors, many in communist China. This is perhaps the true cost of the so-called Green New Deal. Our resources have been redirected to manufacturers, raw materials, and critical minerals that are far from our shores. All the above means rebalancing our energy investment strategy. Thank you for this opportunity to address this committee today, and I'm happy to answer your questions.
Thank you for your testimony, and thank you for your leadership on these important issues. It's very important that we get it right, American energy independence has been at the forefront of this committee's work.
Thank you.
Happy to mention the Inflation Reduction Act includes an all-above strategy, not only renewables, but carbon capture and nuclear. I thank the gentleman for his time today.
You're welcome, and I think that you would find that the relative levels are grossly out of balance in terms of what actually happens in our economy. That's really what I'm drawing attention to. It's not that we don't support all the above, it's simply out of balance.
Thank you. Next, Mr. Landsman from Ohio. Welcome to the Energy and Commerce Committee. You're recognized for 5 minutes.
Thank you, Chairwoman, and to all the members of the committee. It is wonderful to be able to testify today before all of you. I want to thank my colleague from Ohio, Representative Mike Carey, and talk a little bit about this bipartisan bill to deal with the NIL issues in college athletics. You heard from Mr. Carey, so I just want to reiterate a few of the things that he mentioned. It was the first bill that was introduced. It's the only bipartisan bill, but perhaps more importantly, it's a very straightforward, simple piece of legislation that will provide an important fix to the issue that's happening in college athletics. It creates the kind of structure and transparency that will both protect players and programs. And by moving this bill along, it will demonstrate to the American people that this Congress can get things done on issues that matter. And fixing what's broken in college athletics is something that does matter to the American people. As you all know, for a long time, colleges have made billions off of student athletes, and to protect these athletes and to make sure that they receive compensation for their name, image, and likeness is very important, and to have the kind of structure and transparency that this bill provides will help to clean things up. So it does two things in particular. One is all of these programs have a NIL committee. There isn't a national NIL committee. This will provide that. And then two, it requires disclosure of these deals, which provides the transparency that will protect, again, players and programs. So I would just encourage the committee to take the bill up. Again, it's the student athlete level playing field bill, very straightforward, bipartisan, and a good win for this Congress. So thank you, and I yield back.
Thank you for your testimony, for your work. You have the benefit of having the subcommittee chair, Mr. Bilirakis, now in the room to hear directly. We have an open door. We believe that this is very important and want to work with you. And Mr. Carey, this is important to student athletes all across the country. So thank you. Thank you for your work.
I thank the gentleman from Ohio for his bipartisan approach. We want to make sure college sports are decided by athleticism rather than differences in NIL. So thank you for the presentation.
Thank you. Thank you all.
Next up, Mr. Levin from California. Welcome. You're recognized for 5 minutes.
Thank you, Chairwoman Rogers and distinguished members, for the opportunity to testify today on behalf of my constituents in California's 49th District and share their priorities on energy issues. The communities I represent are already feeling the impacts of climate change, from raging wildfires to rising sea levels tearing away at our coast. It's long past time that we take action on climate change that's commensurate with what the science demands. At issue in front of this committee specifically is the equitable transition to a clean energy economy. Last Congress, we passed the Inflation Reduction Act, making the single largest investment in climate action in U.S. history and lowering energy costs for consumers. However, the next challenge to meeting our climate goals is a lack of electrical grid capacity to connect clean energy generation to the new demand that comes with economy-wide electrification. To unlock the full potential of renewable energy and reduce costs for Americans,
our grid needs new high-capacity, long-distance transmission lines to transport electricity from where it's generated to the population centers which rely on that energy to power their homes. That's why I'm pleased to be working on the Clean Energy and Transmission Acceleration Act with my friend, Congressman Sean Casten, who you'll hear from in a second, to support the equitable and efficient build-out of transmission and clean energy infrastructure to meet our climate goals. This legislation will support renewable energy deployment and increase the grid's reliability and resilience in the face of extreme weather events that are increasing in frequency and severity across the country. Further, history has taught us that when we build new infrastructure, we must engage with the communities who will be impacted and ensure that they have a seat at the table in the decision-making process. This not only helps to make projects successful, but it's also the only way we can ensure affected communities are treated fairly. Community engagement is important to address potential concerns early and head off issues that may otherwise lead to time-consuming lawsuits. The Clean Energy and Transmission Acceleration Act will tackle this by expanding the role for disadvantaged communities to be meaningfully consulted as part of the permitting process and ensure an outcome that works for everyone. Additionally, the efficient and fair deployment of renewable energy on our nation's public lands will be crucial to reducing our emissions at the pace and scale necessary to combat climate change. This legislation will support renewable energy deployment in a responsible manner and ensure a fair return for impacted states and communities. I look forward to working with the committee on the Clean Energy Transmission Acceleration Act to advance an equitable transition to a clean energy economy, lower costs for Americans, secure the long-term reliability of our grid, and combat the climate crisis. In addition to the importance of addressing climate change, another issue I hear about frequently from my constituents is the persistent spent nuclear fuel crisis. Whenever we consider the prospects of nuclear energy, we must also consider policies that address the storage and disposal of our nation's spent nuclear fuel. I'm fortunate to represent one of the most beautiful congressional districts in the United States. While we have many incredible resources, none is more important than our more than 50 miles of coastline. Directly threatening this resource is over 1,600 tons of spent nuclear fuel stored just 100 feet from the Pacific Ocean at the San Onofre Nuclear Generating Station. Across the country, there are more than 80 other sites in 36 states where spent nuclear fuel is stored temporarily. As co-chair of the Bipartisan Spent Nuclear Fuel Solutions Caucus, a group of members who care about addressing our nation's spent fuel challenges, I think it's clear that Congress has kicked the can down the road on this issue for long enough. I'm pleased about the incredible progress that we've made with the Department of Energy, restarting and advancing the consent-based siting process for long-term disposal of nuclear waste. However, we still have a long way to go. I've introduced a number of bills which I hope to work with the committee to advance, including the Nuclear Waste Task Force Act to consider updating our laws to enable consent-based siting of long-term storage solutions for nuclear waste, the Bipartisan Spent Fuel Prioritization Act to prioritize the removal of spent nuclear fuel from decommissioned nuclear sites in areas with large populations and high seismic hazards, such as in my district, the INSPECT Act to require the Nuclear Regulatory Commission to keep a resident inspector at decommissioning nuclear power plants until all spent fuel is transferred from its spent fuel pools to canisters, the 100-year canister life to require nuclear waste canisters to have a design life of at least 100 years, more than doubling the current nuclear regulatory requirement of 40 years, and the NRC Office of Public Engagement and Participation Act, which would establish an Office of Public Engagement and Participation at the Nuclear Regulatory Commission. Congress absolutely cannot move legislation related to advanced reactors and nuclear fuels without also fixing our back-end spent fuel problem and ensuring communities are consulted in a consent-based process. So in closing, I appreciate the work of this committee in addressing the key energy issues we're facing. I thank my colleagues for the attention to the issues that I've highlighted today, and I'll yield back.
Thank you for your testimony and sharing your work.
I think the gentleman from California, interstate resilient power lines are going to be critical to 21st century renewable energy, and also a fair way to dispose of spent nuclear waste will be critical for other areas of that are going to be important for 21st century energy as well.
Very good. Thank you. Mr. Casten, please forgive me for keeping you waiting. I messed up on the order of arrival. You're recognized for 5 minutes. Welcome.
Thank you, Chair Rogers. Thank you, Acting Ranking Member Soto, and it's always a pleasure to follow Congressman Levin. So I'm here today to talk about in more detail about the Clean Electricity Transmission Acceleration Act that Congressman Levin and I have introduced. Mike talked a lot about some of the community involvement issues. I want to talk about the market issues. The purpose of this bill is to remove the permitting bottlenecks to transmission that are slowing the deployment of the cleanest and cheapest sources of energy on the grid to the benefit of consumers. We've worked on this bill over the course of about the last 12 months with lots of input from industry, more former FERC commissioners than I can keep track of, developers, environmental groups, and I think also non-trivially the 30-plus years of past experience in the energy industry that Mike and I collectively bring between us before we had our midlife crises and got into this line of work. I want to talk about the market issues, and I hope this is particularly resonant on this committee because transmission is fundamentally different than a natural gas pipeline. When you build a gas pipeline, you have a supplier at one end who's got a field that making something they want to sell. On the other hand, you have a local distribution company, an LNG terminal, perhaps a power plant who has something they want to buy. They have an alignment of economic interests, and the debate is on the middle about is the pipeline safe, is it leak-proof, it's an environmental permitting issue. Transmission is fundamentally different. At one end of the wire, you have somebody who's making something they want to sell, and at the other end of the wire, you don't have a consumer because the consumer doesn't have a voice in that process. What you have is an investor-owned utility, a regional transmission organization, somebody who has a bunch of capital tied up in a current power market that is going to have trouble competing if you bring cheaper power into that market. And so you have this deep conflict of interest that's not really an environmental permitting issue, it's an economic conflict of interest. And so what we like to say is that if you're going to address transmission permitting, you've got to take the 3 Ps in order. First, fix the profit incentives. Second, take care of the participation so that everybody's got a voice at that table, and then deal with permitting. And so we have tried to approach this with that in mind. And I think intuitively we kind of know that, because when's the last time you heard of an investor-owned utility who said, I'd like to build a new power plant in my district, but I just can't get it through the interconnection queue? When's the last time you heard of a regional transmission organization who said, well, I'm really struggling to build transmission within my territory? It's the interregional stuff that matters. That's not because they're bad people. It's because their economic incentives are misaligned. And frankly, I think this committee has proven the way through that. One of the prior commenters mentioned about how much we've decarbonized our grid. That is a direct result of the 1992 Energy Policy Act that came out of this committee, because for the first time after that act was passed, players in the energy space had an economic incentive to preferentially operate their lower cost assets. So we saw a flood of investments in more efficient natural gas. You saw the nuclear fleet go from 60 to 90% capacity factor. You saw prices fall, and you saw the U.S. power grid drop from 1,300 pounds a megawatt hour to less than 900. That is a success. It's a win-win that we can take charge of. So what we've done in this bill is, among other things, to say, let's update some of the market reform processes at FERC. We have power markets that dispatch based on the lowest marginal cost provider. Those market structures don't work in a world that's awash with zero marginal cost generation, like solar, like wind, like geothermal, basically like nuclear. Let's factor in performance-based rates. So instead of having this fight between 2 ends of the wire, we can say to folks at the other end, if you're actively working to decongest nodes on your grid, to shorten the interconnection queue, to help your state meet their clean energy targets, let's increase your return on equity. Let's get everybody aligned so that we can, instead of give everybody a slice of pie, as we make the pie higher, as some folks a couple miles from here once said. Let's address the cost allocation rules so that everybody who actually benefits from these investments also participates in the cost side of the ledger. Let's deal with minimal interregional transfer. And once we do all those things, then let's give FERC sole source authority to approve these permits just like they currently have for natural gas. It's a market-forward approach. It's an approach that puts consumers first. It's an approach that gives us the win-win, and it is squarely within the jurisdiction of this committee, and I hope you'd consider taking it up for debate and a markup and try to bring it forward. Appreciate your time again, and I yield back.
Thank you. Thank you for your testimony and sharing your insights. Very good.
Thanks for the thoughtful analysis, Representative Caston. Appreciate that deep dive. That's going to be very helpful for us.
Very good. Thank you. Next, Representative Houchin from Indiana. 5 minutes.
Thank you, Chairwoman Rogers and Acting Ranking Member Soto, for hosting this Member Day. Thank you for allowing me time to address the committee. I know it's toward the end of the day. I'm going to get right to it. While energy and commerce jurisdiction is broad, I want to zero in on one issue that is of great importance to my constituents, and that is broadband internet access. As a former Indiana State Senator, I worked tirelessly to expand broadband and internet service to rural communities across Indiana. My district was one of the most unserved areas of the state of Indiana, and I made it my mission to work toward access for all. As the committee understands, Americans rely on internet access for telehealth services, to operate and grow their businesses, to connect to educational services, and for precision agriculture. We must make sure that no matter where you choose to reside, whether it's Indianapolis or Salem, Indiana, you have access to the global economy. I'm on this mission as part of an effort to ensure that rural areas of this country do not get left behind. That's why in my former legislative role, I worked to pass legislation to prioritize broadband internet access to unserved communities first. I'm proud of these efforts and Indiana's leadership in investing millions of dollars toward broadband deployment. We are laser focused on connecting these areas of zero access and happy to report that our actions are already making a difference. Indiana's Broadband Ready Communities program and the Next Level Connections program are examples of success at the state level as we continue our work. It's important to ensure that Congress and our agencies are always a partner, not a hindrance, to states trying to connect their citizens. As a new member of Congress, broadband connectivity issues continue to remain a focus for me. That's why earlier this month, I sent a letter to the National Telecommunications and Information Administration's Administrator, Davidson, to express my concern with their recent Notice of Funding opportunity for the Broadband Equity Access and Deployment, or BEAD program. While I was pleased to see Indiana allocated approximately $868 million in funding, the NOFO associated with these funds raises concerns for efficient deployment and, as written, could result in expending vital funding resources for overbuilding in areas that already have access. We've previously seen this happen when funds for broadband were provided to states during the Obama administration, and priorities did not require unserved areas to be connected first. It's one of the first lessons I learned as a state legislator, that there's a difference between unserved and underserved, and we must first focus on the unserved. As this committee has likely recognized, the NOFO contains several sections related to labor requirements and mandates, specifically those related to affordability and rate regulation, as well as sections related to climate change and certain supply chain and other issues that I fear may unnecessarily slow deployment. Like I said in my letter to the administrator, our focus should be on getting all Americans connected to the internet, utilizing a strategy that's focused on quickly and efficiently reaching the greatest number of homes for the least cost, with an emphasis on providing adequate speeds and service. We should not be enacting a political agenda that is out of touch with the needs of states, including my home state of Indiana. The NOFO in that regard is too prescriptive and full of priorities from the left, rather than placing an emphasis on an efficient and thoughtful deployment. Our job is simple: connect people to this vital service. There is no room for politics when it comes to connecting America. We shouldn't be politicizing a program that has broad bipartisan support. End of story. Additionally, Chairwoman Rogers, I want to thank your committee staff for working with mine on ways to effectively measure just how successful our various broadband programs are at connecting our constituents. Since many of our broadband programs receive significant investments of taxpayer money, we have a responsibility to ensure that these investments are carried out responsibly. Thank you again for allowing me the opportunity to speak on this issue today. I look forward to continuing to work with you and the committee and your staff on these efforts, and I yield back the balance of my time.
Thank you. Thank you for your testimony and sharing the Indiana example. I share your commitment to ensuring that we take this opportunity, we don't miss this opportunity to really focus on the truly unserved all across the country. So we're going to stay on this, and we'll work with you on it.
I was proud to cast my vote for the Bipartisan Infrastructure and Investment Act, and we definitely need to prioritize unserved communities, including those in both of our districts, among others across the nation. Many of us have rural areas, and this is critical for everything from economics to healthcare.
Thank you.
Very good. Thank you. Next, representative from California, Mr. Khanna, you're recognized for 5 minutes. Welcome to ENC.
Thank you, Chair Rogers, and thank you, Acting Ranking Member Soto. Thank you both for the opportunity to testify about my bill with Representative Buddy Carter, the Stop Institutional Child Abuse Act. As you know, Buddy Carter has been an active member of the Energy and Commerce Committee, and he has been a co-equal partner on this. When Paris Hilton first approached our offices and asked us to introduce this legislation regarding the troubled teen industry, I actually wasn't familiar with the issue. But after hearing her story and the story of so many survivors, it has become clear that Congress needs to act with urgency. There are currently at least 120,000 minors in these youth residential programs across the United States. And unfortunately, many of these facilities have been hotbeds of institutional child abuse, neglect, and sexual abuse. The lack of transparency and accountability for care has led to physical, emotional, and sexual abuse of vulnerable children. It's unacceptable. These facilities are entrusted with caring with some of the most vulnerable children in America. My bill with Congressman Carter addresses directly this issue. It seeks to create actual transparency around youth experiences in congregate care facilities and to study best practices to prevent institutional abuse. It will have a group of experts establish what these practices should be. We also need estimates on how many youth are actually in these facilities. The bill also directs a study on exactly how federal funding is currently being used in these facilities. The bill has 45 co-sponsors on a bipartisan basis, 9 of them from the Energy and Commerce Committee, and we've also been working with Senators Merkley and Senator Cornyn, who have introduced this on a bipartisan basis in the Senate. And Chair Rogers, your staff has been incredibly helpful to us as we made progress on this, as is the minority staff. This is an institution in dire need of transparency. I don't believe the bill will score very high at all on the CBO. It's more about setting standards, and I'm really grateful to the survivors who've come forward, and of course to Representative Carter for truly making this a bipartisan effort. I look forward to working with the committee and would hope, when appropriate, if we could have a markup and hearing on the bill. Thanks for your consideration.
Thank you. Thank you for your testimony. We look forward to working with you on it.
Thanks, Representative Khanna, for your and Rep. Carter's amazing leadership to help protect our kids.
Thank you.
Okay. Next, Representative Chavez DeReamer, recognized for 5 minutes.
Well, good afternoon, Chairwoman Rogers and Mr. Soto. Thanks for holding this session today for members. Throughout the country, neighborhoods have been experiencing an unprecedented homelessness crisis. In Oregon, this crisis has persisted at a level far outpacing other states. There isn't a single person, I believe, who doesn't want to fix the problem, who doesn't want to help our homeless neighbors find stability. But the approach has been too narrow, hyper-fixated on housing. Housing, undeniably, is the biggest factor to consider when examining the issue, but it's not the only one. If someone you know is trapped in the spiraling cycle of dual diagnosis condition, being addicted to a drug, while also fighting a mental health disorder, and that person is going without care, how could you expect them to transition into sustained and stable housing? Our homeless community is going without access to real and direct health care. Yet we maintain an expectation that if you just build the housing, their very real health problems, which often are the causes for their homelessness, will no longer be an issue affecting their living situation. Providing health care to this vulnerable community is the missing piece in fixing this crisis. Doing so isn't going to solve the issue by itself, but you cannot end this crisis without it. However, we cannot do this within a system that is not designed for the homeless, a system which currently requires homeless individuals to travel miles from where they live, risking their property being stolen to receive care at a brick-and-mortar clinic. And if they have the money for a bus ride, or even if they can walk, and oftentimes our veterans are in that category. That is why I, alongside Congresswoman Summer Lee, have introduced the Direct Care for the Homeless Act. This necessary legislation would provide accessible and direct health care to our homeless neighbors, right where they live, helping them transition off the streets. It does so by creating a 4-year pilot program, expanding the homeless access to street medicine providers. Street medicine providers feel the need for care by going directly to the patients, providing care on the streets, in encampments, and any place a homeless patient lives. This direct approach streamlines access to dual diagnosis care, primary care, and any other untreated health care need which is keeping a person trapped on the streets. Our pilot program will be available for credentialed street medicine providers who work in cities or counties experiencing the homelessness crisis at serious levels. It will establish a reimbursement process for these providers, so it's practical for the doctors who participate. But it explicitly prohibits reimbursements for supervised consumption of Schedule I drugs, fentanyl, cocaine, and meth. The program would also grow the needed workforce to sustain an effective street medicine approach. Street medicine providers will be eligible for the Public Health Loan Repayment Program. Medical students and residents who serve in the program focused at all on street medicine will be eligible for a pause on both their student loan payments and accrued interest. And perhaps most importantly, community service officers employed by local law enforcement will be eligible for the Public Service Loan Forgiveness Program. I want to place a particular emphasis on this provision. In every city and county dealing with the homelessness crisis, cops are stretched thin, responding to calls about a homeless person sleeping outside of an encampment in front row or a local business. It shouldn't be police officers dealing with these calls. Their work hours need to be reserved for immediate life-threatening emergencies. That's why I'm proud to have the support of law enforcement in putting this bill forward. An influx of community service officers will free up the lives of cops and notably improve conditions for both the homeless and their neighbors. Our bill also improves conditions in homeless shelters by requiring the menstrual products be available, and that basic security cameras, which can be bought oftentimes on Amazon for a very low cost, will be placed in these non-invasive areas of the shelter. In providing health care to help people transition off the streets, we do need to make sure that the temporary housing options are real options. Too often, women will opt to live out of their car instead of staying in a shelter because of how dangerous some shelters can be. This results in piled-up parking and trespassing tickets, which create both insurmountable debt and criminal record, which makes it near impossible to find a job. The crisis can and must be fixed. No person often chooses to be homeless. The stigmas, years of inaction, narrow approaches to helping this community have done nothing to improve these conditions. Please, let's stop this pattern of failure. Thank you, and I'd be happy to answer any questions, but I do thank the committee for this testimony, and I look forward to working with the committee and the chairwoman and the acting chairman to move this further down the road on a bipartisan level.
Well, thank you very much for coming in before us today. We greatly appreciate it, and especially your work on the area, because we know that homelessness, what's going on out there on the streets takes up a lot of resources, but it's also very important that we get the resources out to people that need them. Gentleman from Florida.
I thank the gentlelady from Oregon for bringing forward this bipartisan, out-of-the-box approach to help homeless individuals where they're at on healthcare and mental health, and look forward to hearing the bill.
Thank you. The gentleman from Mississippi is recognized for 5 minutes.
Thank you, Mr. Chairman and Ranking Member. And I'd like to say I would be glad to help you. I've spent 42 years in police service, and that's just exactly about some of the things I'm going to talk about today. So I'll be glad to share any knowledge that I may or may not have. So I thank you for giving me the opportunity to come before the committee today and share some of the issues that are facing Mississippi's 4th Congressional District. Coming before you today, I bring with me a unique perspective on health care, shaped by my experience as a sheriff, a police chief, and a police officer for 42 years of my life. In my previous role, I witnessed many connections between public safety and health care, an experience that underscored the significant effect of quality health care on the well-being of our communities. This includes a dire need for the attention of mental health, substance abuse, and the overall delivery of care. Mental health issues and substance abuse do not discriminate. They affect every facet of our communities. Time and time again, I saw these tolls issues took, not just on individuals, but on families, our communities, jails, and our hospitals. It became abundantly clear that our most vulnerable communities lack the resources necessary to address these challenges. Additionally, the continuous failure to look at these issues collectively puts the health and safety of our communities at grave risk, a risk the people of South Mississippi simply cannot afford. I commend this committee for its long-standing bipartisan efforts to bridge the gap between these critical issues, most recently demonstrated through the SUPPORT Act reauthorization. However, we must recognize there's still much work to be done. The COVID-19 pandemic underscored the vital importance of healthcare in our society while showcasing vulnerabilities that warranted innovative approaches to care delivery, such as telehealth. Telehealth has proven to be a lifeline for expanding care and providing for our most vulnerable populations. We must continue to build on this effort to grow access to care, ease the burden these crucial issues have on my district. Mississippi has been a leader in this delivery reform, standing up one of the most robust telehealth systems in the country, one that has been modeled by many states from coast to coast. This was a learning experience from the worst natural disaster decades to ravage our community was Hurricane Katrina back in 2005. We learned so many things from that dreadful storm, and Congress must acknowledge the delivery reforms that led to increased access to mental health and substance use care during the pandemic. I urge the committee to continue their bipartisan efforts to expand access and explore new delivery models. And thank you, sir. I yield back.
Well, and thank you for coming before us today. When you talk about on the telehealth side, that is an issue, especially that really came during COVID. And I know I was on some calls prior to COVID saying that telehealth would never work. 3 weeks into COVID, we were being told if we didn't have telehealth, the system would have collapsed. Also, thanks for your years in law enforcement. But I know that when I'm in my district talking to my sheriffs, our county jails are not our mental health institutions out there, a place where people can get help. We're overwhelmed, and I know talking to my sheriffs that they just need help. So we appreciate you coming before the committee today. The gentleman from Florida.
I thank the gentleman from Mississippi for your commitment to telehealth. It's particularly critical for those of us representing rural areas, and we passed that first waiver right in February, March of 2020, right here in this committee to allow us to go boldly forth, and we appreciate the innovation of states like yours and working on it and continuing this expansion.
Thank you very much.
Thank you again. The gentleman from Michigan is recognized for 5 minutes.
Thank you, Mr. Chairman. Go Blue. But on a much, much serious note, I'm really glad that this committee is on the topic and subject of mental health and substance abuse. Just yesterday, a group of bipartisan legislators met on the House floor steps, and we stood together in support of substance abuse awareness and mental health awareness. And I so sincerely hope that we can remember that stand when legislation like my H.R. 4101 Bipartisan Road to Recovery Act comes to the floor. With the help of this committee, I do believe that it can be possible. Opioids have left a trail of destruction, heartbreak, and broken families in its wake. And Americans caught in the middle of the opioid crisis need our help and support now. The opioid crisis impacts communities across the nation, but especially the communities in Michigan's 10th Congressional District. One of my constituents, a brave mother from Rochester Hills, testified in Congress about how the opioid crisis has impacted her family, taking the lives of her sons far too soon. To the leaders in Congress and in the White House, I ask you, was her testimony in vain? I certainly hope not. We all have a responsibility to end these tragedies that are going on each and every single day across America. We must be dedicated to doing the right thing to save lives, to put pragmatic policymaking ahead of partisan politics. This is why I'm proud to introduce, again, H.R. 4101, the Bipartisan Road to Recovery Act. This bill reauthorizes life-saving resources vital to addressing the opioid addiction and substance abuse crises across the country. This will ensure that those dealing with mental health and/or substance abuse disorders have access to free, confidential treatment, referral, and information service helplines. I want to thank my colleague, Rep. Cardenas of California, for his partnership on this bill. And this proves that we can truly work together to benefit the American people when we try. This opioid epidemic has reached every single one of us, and we must make sure that we devote resources to help these families. Next, I want to discuss the disastrous EV transition that this administration continues to force on the American people. I wish I had all day to express the outrage of my constituents, from automotive manufacturers to suppliers to dealers, but we don't have all day. Some have called this transition just plain bad policy. Others had called it a transition to hell. I agree with both characterizations. This administration is taking away our choice and forcing a comply or die EV mandate. This mandate's already burned billions in American taxpayer dollars on capacity that does not exist for autos that people can afford in demand that hasn't materialized yet. This infrastructure is currently not ready, and this administration is intent upon building the middle class in China on the backs of the middle class in America. Auto workers in my district get up every morning and work hard for a living. They go to work. That's the Michigan way. Meanwhile, coastal elites in the Biden administration wake up and go to the couch where they work from home. Michiganders and people from all over the country who have to work hard each and every single day to put food on the table don't have that luxury. While the administration works from home in empty office buildings all around D.C. with the ever-ballooning cost of government and ever-ballooning head count in D.C., they're gutting our local economies by mandating an EV transition that caves to the CCP, and its chokehold on the American auto industry is being felt throughout every sector of America. This administration is sacrificing the Michigan economy on the altar of their radical green agenda, and it must stop. Michigan families and workers are being left holding the bag. So let me be crystal clear. There's nothing fair about this. There's nothing right about this. There's nothing just about this. There's nothing common sense about this. There's nothing sustainable about this. This is about a radical EV transition. It's a race to the bottom for our working families, and it has to stop right here. This is designated to create pain for auto workers and pain for people at home, so they will go into vehicles that they cannot afford yet. This is designated to hurt, not to help. And we are here to help people, to make sure that we retain choice and that the government never forces itself upon the American people. I want to thank you, Mr. Chairman, for the time here today to express the sentiments of my district. And I want to thank you for your work on helping to end the opioid crisis. I, along with my staff, stand ready to continue working with this committee and with this GOP-led Congress to do everything that we can to maintain our national security, retain our economic prosperity and strength, and to make sure we make a better future for the United States of America. With that, Mr. Chairman, I yield back.
Thank the gentleman for testifying and for your leadership on this issue. We'll take that into strong consideration.
Yes, ma'am, thank you.
I thank the gentleman for his bipartisan approach on combating the opioid crisis, and we could agree to disagree on the other topics for today. Thanks for coming in.
Thank you. Next, I'm pleased to welcome to the Energy and Commerce Committee room the chairman of the Resources Committee. Appreciate your leadership. Representative Westerman, you're recognized for 5 minutes.
Thank you, Chair Rogers and Ranking Member Soto. I appreciate you hosting today's member meeting. I know our committees have worked closely together on a lot of energy stuff, but your committee covers a lot of things who members like myself don't get a chance to work on as much. Issues that your committee has jurisdiction over that are important to all of our country. So I appreciate the chance to get to come visit with you today. One of those issues that I know is front and center here is the dire need to reform our healthcare system and the federal government's role in healthcare. My district, the 4th District of Arkansas, is large and rural, And while I have the privilege of advocating for a wide variety of people from all walks of life, I think they would all tell you that they share in the frustration of a high cost of care. In rural America, we also face a high risk of losing vital health services due to the unique challenges that rural areas face. Healthcare costs, as you know, continue to rise across the board, and your committee has done extraordinary work shining a light on the cost of care. I would say that if we truly want to address our fiscal situation that the federal government needs to address, then we have to address the rising cost of care because it's one of the largest drivers of the federal budget. There's a lot of finger pointing. There's always been a lot of finger pointing on health care. And while the blame game will continue, I know that people in my district and Americans across the country are still struggling with high cost. And that gets to the solution that I want to propose, and not to point fingers or play the blame game, but look at how we can actually fix what's wrong with our healthcare system. And I have a bill called the Fair Care Act. It returns competition to the healthcare marketplace, lowers prices for drugs, coverage, and care, and gives every American the ability to take control of decisions affecting their health care. I'm proud to have seen so many policies similar to fair care become part of other legislative packages that have passed committee with resounding bipartisanship, such as your very own recently introduced Lower Cost, More Transparency Act. While price transparency is a necessary first step, I believe there's still more that has to be fixed to correct the deeply embedded faults that lie within the system if we truly want to empower the consumer and the patient. The Fair Care Act's answer to our nation's health care crisis, I believe, is the most comprehensive bipartisan package that addresses the root causes of many of the perverse incentives and burdensome regulations that plague our system, and they could actually pass the Senate and become law. This bill's been in the making for over 5 years. Even though I'm not on this committee or Ways and Means, I've been continually working on this bill, and I can't take credit for it, but for all of it, because what we've done is taken a collection of bipartisan bills that have 3 objectives: cover more people, cover pre-existing conditions, and lower cost. Now, who couldn't be for that? And we found that there's a lot of individual bills in the House and the Senate that address those things. We've put them together in the Fair Care Act, and a lot of those individual measures have been passed over the years. I'll briefly tell you, there's 4 main parts to the bill. The first modernizes health savings accounts by combining the various savings accounts from HSAs to MSAs into one pre-tax healthcare spending account. It can be used for a broad range of medical expenses, including insurance premiums and direct primary care. The second part improves private health insurance by strengthening market-based exchanges and lowering premiums to give more personalized health plan options. The third and fourth parts reform hospital provider, insurer, and prescription drug prices, as well as Medicare and Medicaid to further increase transparency, lower cost, and ensure program solvency. These broad-ranging solutions come from many pieces of legislation, as I mentioned, from stakeholder input, and have been reviewed and refined by several healthcare policy experts. I hope this legislation can stimulate conversation and serve as a starting point for how we can take the next steps to reform our broken healthcare system. Thank you again for welcoming me today, and I look forward to working with you to solve the problems not only for our current constituents, but as a solid foundation for those to come. I yield back.
Well, we thank the chairman for coming before us today and the passion that you show, because this is an issue that this committee has been working on. And we've got a lot of work to do into the future, but appreciate your work on it. And again, thank you for being with us. And you recognize the gentleman from Florida.
Chairman, it was an honor to serve with you on natural resources the last 6 years, and appreciate finding common ground like we're doing here on both price transparency and on lowering costs with several bills, as you mentioned, that had passed through. So appreciate your suggestions today.
Thank you, and we've got your bill on markup tomorrow.
Well, thank you. The gentleman from New York is recognized for 5 minutes.
Thank you, Mr. Chairman. I appreciate the opportunity to present to the committee today, and certainly appreciate your leadership and the leadership of the chairwoman. I would like to discuss just a couple items that are of significant importance to me and the folks I represent in the 19th District of New York. One of the top priorities I've brought forward here to Congress, and I know that the chairwoman shares in both life experience and passion, is the support for those individuals with intellectual, physical, and developmental disabilities. When I served as county executive in Dutchess County, New York, in fact served there for 12 years, we launched the Think Differently initiative to change the way in which individuals, businesses, and other community organizations relate to those with intellectual, physical, and developmental disabilities. Having personal experience in facing these challenges, I raise and I'm the proud father of 4 children, one of whom, my daughter, my oldest, lives on the autism spectrum. She has helped to define our focus in this journey of advocacy as a family and for me as a public official. As a member of Congress, I brought the Think Differently initiative here to Washington and made it part of my federal platform. The first bill we introduced was the Think Differently Database Act, which creates a comprehensive and easy-to-access website and platform that includes support services and resources available for those with physical, intellectual, and developmental disabilities. We're currently finalizing the details of this bill with committee staff and hope to soon have it ready for a markup. This is my top legislative priority and very important to millions of individuals across this country living with disabilities. The bill was inspired by the Think Differently website I created as county executive, which is designed to intuitively point individuals and their families to the services and connections they need based on where they're located. Additionally, I'm currently working on a bill to require FEMA to conduct a review and report on resources provided to those with developmental disabilities affected by disasters. Additionally, we're working on legislation to ensure that Amtrak, which has notoriously not lived up to its obligations to meet ADA compliance, we're working on a bill to ensure Amtrak finally lives up to those ADA compliance obligations by submitting their progress to Congress. Now, I'm proud of the work we've done to break down barriers and open opportunities for those with disabilities. However, as I know you know, there is so much more to be done to deliver comprehensive care and support that individuals with disabilities need. Now, another topic I'm passionate about is how lawmakers can increase access to mental health services and support individuals living with substance use disorder. Sullivan County, one of the counties in my district, in upstate New York, has the highest rate of opioid deaths in the state of New York. This is, for me, a top priority to ensure that individuals receive the comprehensive support they need to overcome addiction and go on to lead fulfilling lives regardless of their zip code. As Dutchess County executive, I developed a nationally recognized stabilization center that offered walk-in care for individuals with mental health and substance use disorders and the most comprehensive network of community-based mental health services of any county in America. Now in Congress, I remain committed to working with my colleagues across the aisle to combat our nation's dual crises of substance use and mental wellness. Lastly, the last topic I just want to highlight is also a priority, and that is streamlining energy projects, lowering energy costs, and protecting the environment. We need to continue to work towards substantial permitting reform and reduce the red tape that often blocks natural gas and clean energy projects, especially in the state of New York, which is notorious for holding up projects through the NEPA process. Mr. Chairman, I thank you again for allowing me to share with the committee some of my priorities and the issues that are important to the constituents I represent in the 19th Congressional District. And I look forward to our continued work together to support those individuals with physical, developmental, and intellectual disabilities. I thank you very much and certainly welcome any comments.
Well, we thank the gentleman for coming before us today, and you're absolutely correct. The gentlelady from Washington, the chair of the full committee, is passionate on working on issues for those with disabilities. You're absolutely correct, too, when it comes to finding resources. It's sometimes very difficult to find them out there. I know that we worked on H.R. 6 several Congresses ago, especially dealing with opioids. I had legislation that was included in there to establishing a dashboard to make sure that at least those that are out there in our communities can find those services. So it's absolutely important that we get these things done. Permitting is another issue that you bring up that the committee has been working on because, again, we've got to move these projects along. We can't have these things held up. So that's essential. So we appreciate you coming before us today.
Thank you.
The gentleman from Florida is recognized.
Thank the gentleman from New York for your passion and personal story and your advocacy for Americans with disabilities, as well as your work on mental health. Thanks for your presentation today.
Thank you.
Thank you again. Seeing no other members wishing to give testimony before the committee today, I ask unanimous consent to insert in the record of the documents included on the staff hearing documents list, and without objection, so ordered. Without objection, the committee is adjourned.